Well, thank you for joining me, and I want to help you heal gingivitis fast. In order to know if you have gingivitis, we'll cover what it is, how it occurs, what happens if you don't deal with it, and what can progress if you leave it alone, because it's kind of conflicting. It's very difficult if you don't know what's going on. You may think it's got better when it hasn't. And then from the consequences, we'll talk about how quickly you can heal gingivitis, and when you heal it, how you can make sure it doesn't come back, how you maintain a healthy mouth and avoid gingivitis. So what is gingivitis? I mean, you may have heard it, the dentist may have mentioned it. Basically, it's when your gums become sort of puffy. What you'll see is a puffiness, possibly a redness in the gums, and they may bleed when you brush them. And what a lot of people do is when they see their gums bleeding, I mean, most things in our body, when they bleed, you kind of leave them alone. That is the worst thing you can do. So if you go no further than this, if you have bleeding gums, what you need to do is brush them. And there's more to that than just grabbing your toothbrush and brushing them. What you need to understand about gingivitis is it's a kind of infection. You see plaque, which is basically bacteria that we don't want in our mouth, that are stuck to each other and massed together, and they lodge between the tooth and the gum, in that crevice where the tooth goes into the gum. And when they lodge there for longer than 24 hours, there's a good chance that they will thicken up and that the bacteria on the inside of your tooth, because they're layering one layer upon another, the inside bacteria of this plaque change. They become more aggressive because they become anaerobic. They live without oxygen. And when they get to that stage, they start to pump out poisons or toxins that irritate your gums. That's why your gums become red and swollen and irritated. And if you stop brushing them, think about it, more will develop. They are sticky, these bacteria. They stick to one another. They have little glycoprotein pads that attach one to another, not only sideways, but also in thickness. And they feed on sugars. So if you're eating carbohydrates or sugars, then you're going to be feeding these little critters, and they're going to be more of them, pumping out more poisons and more inflammation in your gums. The other problem is once they get to becoming anaerobic, they can even break down dairy. If you're drinking milk or dairy products, they can even exacerbate that problem as well. So once you get thick plaque accumulating on the gum where the tooth goes into the gum, you're going to have big problems. And the quickest way to remove those problems, you may want to give up sugar. That's great. You may want to change the frequency of your eating, because if you're eating lots of little bits of sugar, or you're sucking a hard candy with sugar, especially if it's late at night, sometimes it's in hidden things like an antacid, something for acid reflux can be a sugar pill, actually. And look at the ingredients on things. So many things have sugar in them. So my recommendation to begin with would be to start eating and drinking at meal times, and then try not to eat and drink between meals. If you finish your meal with 100% pure xylitol mints, it'll help loosen this plaque so it falls off your teeth. It'll also, if you then don't eat or drink, the xylitol will feed good bacteria that will also help to dislodge this plaque and get it away. So you will improve this problem simply by controlling your meal times, ending them with some xylitol, and then don't eat or drink for an hour afterwards. The next thing to consider is your mouth dry? Because the drier your mouth, the less saliva to wash these bacteria away. And oftentimes you'll get this plaque buildup if maybe you have a sinus infection, or you're taking sinus or allergy medication that is drying your nose, making you breathe better, but it may be drying your mouth at the same time. Medications for heart problems, kidney problems often will dry your mouth as well. So be aware, you may have suddenly started taking a medication and be unaware of why all of a sudden you've got this plaque building up around your teeth. Dry mouth is one reason. Often frequency of sugar eating, so diet can be a contributor. But one of the things I want you to do as quickly as you possibly can is get yourself a clean new set of toothbrushes. And the reason for this is that so often people are careless about their toothbrushes. And if you have gingivitis, realize that the last time you brushed your teeth, you will have picked up all the bacteria in your mouth. You can actually send a toothbrush to a lab and they can cultivate all the bacteria in your mouth from the toothbrush. It's pretty scary if you consider that. Up to 800 different kinds of bacteria may be living on your toothbrush. And the trouble is that the right kind of toothbrush that you want to use to adequately clean your teeth is usually one with lots of bristles. And when you have lots of dense bristles, it's really easy for the bacteria in those bristles to grow, again, anaerobic bacteria, and become more aggressive. And if you soak your toothbrush to try to clean it, you're simply going to make your toothbrush too soft. And if you soak your toothbrush in vinegar or in baking soda or in Listerine or in anything, the chances are that liquid can easily make things worse. So my suggestion is get a clean set of toothbrushes. If you brush your teeth twice a day, which is my recommendation, make sure that you dry those toothbrushes between uses. That means simply putting them in a cup or a glass, or you can buy little donut things that stand your toothbrush up, and let the morning toothbrush dry and use it every morning. And your evening toothbrush, use it every evening. Preferably keep them away from toilet plumes, because your toilet, when you flush it, may well have fecal bacteria that can be transporter bacteria. They can get involved with bacteria in your mouth and make them more aggressive. Now, I don't want to go down that road too much in this video, but simply to say toothbrushes need to be clean, particularly if you're trying to use it to cure gingivitis. So your best bet may be to buy 2 new toothbrushes. Don't buy really soft ones. Buy ones that have some resilience. On my website, I recommend a specific brand called Mouthwatchers that I love because they are really good for massaging the gums and for cleaning your teeth, which is what you need to do. The strategy that I recommend is my complete mouth care system. And it is 3 mouth rinses and a special Crest Original Cavity Protection toothpaste. If you're in other countries, it becomes more difficult, but you can learn a lot from my website. And basically, you need a clean toothbrush, and then you need a good toothpaste at the very least, and you need to massage your gums where they're bleeding, massage them, and clean away the tooth at that point where your tooth is, where you see the gums bleeding. You have to really give that tooth a good cleaning. Don't be scared that you're going to cause gum recession. Don't be scared that you're going to wear your enamel away. This is why I like you to use a pre-rinse, ideally with the mouth rinse that I recommend. That is a rinse you use before you brush your teeth. If you can't access that mouth rinse, maybe just rinse with water and then brush your teeth. And brush really well on the outside, up on the gum, and on the inside, up on the gum as well as the tooth. I don't recommend flossing at this point because I believe the gum is very fragile. The last thing I want you to do is push harmful bacteria into your bloodstream. So I am the one dentist or two that do not recommend flossing at this point. That is why I recommend the use of specific mouth rinses that have been shown to be as effective as floss, which you can rinse back and forth between your teeth and then finally rinse off your teeth. That would be the right kind, the right formulation of Listerine, followed by the right kind, the right formulation of Act. This is complicated if you want to follow my system with just me describing it. I recommend going to my website where there is a free downloadable booklet and links to the products on Amazon. When you use my complete mouth care system, when you do it twice a day, massaging this area with a toothbrush, massaging all your gums with a good toothbrush, and cleaning your teeth vigorously because you're not scared of brushing them, you will find that your oral health improves dramatically. The xylitol at the end of meals is going to form a base of protection over your teeth to stop this plaque coming back. It's also going to make your teeth feel smoother so that less plaque sticks to them. And the xylitol is able to make plaque gradually disappear. That's going to take 6 months, but in 1 month, in 4 weeks, you're going to see an incredible difference just by these strategies. I suggest you keep a journal because you may be amazed how quickly things change. And the key to this is not to be afraid of making your gums bleed, but to brush them more. Now, there is a component because your body needs to fight this infection. If you like to take a digestive probiotic to support your immune system, I'm in favor of that. An immune support digestive probiotic, I have links again to Amazon products on my website. The diet that you're going to consume, maybe do a Google search or go to my website to learn more about the foods that will support your immune health. Things like garlic, onions, mushrooms, green leafy vegetables, fresh fruits and vegetables. You need to include lots of these healthy immune supporting foods into your diet for that first month, particularly when you are just starting to change your oral health and get rid of gingivitis and get your gums to a state of tight, healthy elasticity. They need to become really tight and elastic around your teeth with no pocketing. You see, the danger, if you don't take care of gingivitis, is very quickly this bleeding will stop. Your gums will appear to get less red. You may think, it went away. And you didn't change a thing. What you don't know is that under your gum, new kinds of bacteria just found a little hole, a little pocket. It's a little separation between the gum and the tooth that occurred because your gum got all puffy for a minute, and then when the immune system gave up, it just collapsed back, but left a little vacant space. And in our saliva, in everybody's saliva, are things called opportunistic bacteria. They are bacteria, very bad ones, that are just looking for the opportunity to multiply. And they need a dark, protected space in which to multiply. And this little vacant space you just opened up 2 days ago with your gingivitis is exactly what they're looking for. And they will get into that little vacant space and burrow their way down. And because when you're brushing your teeth, it's really easy to transfer bacteria around your mouth, or if you go for a dental appointment or a cleaning, it's really simple for these bacteria to find more pocketing spaces. So dental cleanings are not the answer. They're not going to make things better for you, in my opinion, unless you are not going to take care of this by yourself. If you really want your dentist to look after you, then yes, I guess a dental cleaning is the next best thing you can do. But if you want to take control, use the strategies I recommend. Use these good toothbrushes and massage the gums. Go through a 2 or 3 day process of healing your gums, changing your diet, being certain not to eat and drink for several hours after meals, and you will seal this pocket back up tight, and that will stop this periodontal disease from taking hold. It is the easiest way to stop the second phase, which is periodontal disease. You see, gingivitis is dangerous because it's stage 1 of a very damaging periodontal disease that dentists say is incurable. I don't. I believe that my system can take you on a journey back to health, but don't let it go there. Take charge. You may only be 18 years old. You may not be thinking about keeping your teeth till you're 65. But when you are a teenager, when you see your gums bleeding, this is the beginning of periodontal disease if you don't take care of it. And we know in America that 50% of 30-year-olds have periodontal disease of this kind, and they don't even know they have it. And it can affect your risk for preterm birth if you're a woman and about to give birth. Your gum disease, your pink bleeding gums, your toothbrush covered in blood when you brush your teeth is an indication that you need help. And I beg you to get on my complete mouth care system and the use of xylitol as quickly as you can. If you're a guy, you don't want gum disease either, because this can affect your heart if you have a history of heart problems, which many men do in their families. If you generally have a risk of Alzheimer's or arthritis as you look at your parents when they got older, and if they have a history of gum disease and bad teeth, even if you're 18 and your gums are just bleeding a bit, I am here to tell you this is the first stage, and it is so quick. In a matter of 3 or 4 days, you can heal that problem, seal up your gums, and protect yourself from what can be a lifetime of never-ending treatments and progressively invasive medical conditions that could have been completely prevented. So I thank you for your attention. I hope you understand how passionate I am about helping you avoid dental treatments. I would not run directly to a dentist for cleaning. I would use my complete mouth care system for at least 12 weeks if possible, and potentially longer if you see progress, before you go for cleaning. This is what I did for my patients in my practice. They would have the opportunity to decide, would you like me to do a cleaning now? Or would you like to go away, get your mouth healthy, and maybe you won't even need a cleaning? Or maybe if you need one cleaning now, you will make your mouth so healthy you don't need cleanings, and you can maintain your oral health for the rest of your life. Something amazing and potentially possible to do. So please visit drellie.com, my website, where you'll get help, details, and I have a video oral health boot camp that you may learn more from.